Hi guys, this is Ava from Bay Harbor Med Spa, and this is a question by a 16-year young female. And she wrote me a quite extensive email stating that she has a terrible cystic acne, that she went off gluten in her diet for a month, and she had the cystic acne only one side of the cheeks, and that a few days ago she went back on the gluten diet, that she's eating now food with gluten, and she noticed that she broke up on the other side of the cheek, and she describes it as cystic acne. Whether I think that the gluten is the culprit, I don't. There is no proof, no evidence anywhere that suggests that one particular food or another food would be a culprit to acne or cystic acne or acne vulgaris. What I would say and what I would suggest is the following. You are 16 years of age, you are in puberty, you are a teenager. It is absolutely normal for you to break out. Now, I don't know if you have cystic acne, if you have acne vulgaris, or if you just have acne because you're 16 years and maybe you are very knowledgeable and very smart and you researched it and looked at pictures and you determined that you have cystic acne, or you went to a doctor. But if you went to a doctor, the doctor most likely would have told you that the gluten is really not relevant to cystic acne, and that there is really no proof, no evidence anywhere that one particular food would cause acne. What there is evidence of is that acne is a skin disease, it's a condition, and as prevalent as it is in people, we really don't know why people get acne. We know some of the causes of acne. We know, for instance, that hormones play a role in it. We know that heredity plays a role in it. If your parents had acne, if there was acne, acne vulgaris, or cystic acne in your family, most likely you will have it. So we know heredity, we know hormones, we know stress, but we don't know really what really causes it, what starts it. We just know some of the cases, some of the reasons why you get it. But there was no cut dry evidence anywhere that said that gluten or any other kind of food would really cause you to break out. Of course, healthy diet is much better than diet that is full of junk and oil and fat, because it's not healthy for your system generally. So my answer would be no, I don't think it's gluten. I just think that either it's heredity, either it's your puberty, either it's your hormones. But if you think you have cystic acne, I suggest that you go and see a dermatologist who should determine that indeed that's the case, and that if it's cystic acne, then you definitely need to be under medical care, because that's more than just regular acne. Cystic acne is really under the skin, lots of cysts, lots of congested skin, and cystic acne most likely is treated with antibiotic to start with, retinoid or Accutane, and in some severe cases the doctor would also inject the cysts so that they shrink, because they are painful, and that they leave no marks on your skin, or minimal marks. So my suggestion would be that you ask your parents, since you're 16, you're still very young, that they shall take you to a dermatologist, and he's the one to make the determination that indeed you have A, B, C, D, and he should make the suggestion as to what treatment you should undertake. Okay, so I hope that I clarified this for you and for many other people out there. Thank you for listening. Bye, Eva.